The death toll keeps rising, and a new strain of swine flu is believed to be the culprit so far. 57 deaths are reported in Mexico. 16 are confirmed to be from the virus, and more than 900 other people have also become ill. In just a moment, we're going to hear from our local health unit on what to guard against if you're traveling south. But first, Julia Burke on what scientists know about this latest strain.
Hello. I have a few questions to ask you. Do you have any cough, cold, or shortness of breath?
I don't. At hospitals across the country, staff are on high alert, and signs warn people who travel to Mexico to make it known right away to emergency room nurses.
Anyone who comes into our department is required to wear a mask.
Joy McCarran works at this hospital in the town of Newmarket, just north of Toronto.
We've had 4 patients thus far identify themselves to our triage nurse that they had recently traveled to Mexico and have experienced symptoms.
Symptoms that in Mexico have turned deadly. The country is dealing with what it calls a respiratory epidemic, a new strain of swine flu. So far, 16 people have died, 44 other deaths are under investigation, and more than 900 people are ill.
Now, what makes this severe respiratory illness particularly alarming is that it's attacking healthy young adults in their 20s, 30s, and 40s, not the very young and not the very old, which is often the case with different types of influenza.
In the United States, the Center for Disease Control has now confirmed there are 8 cases of the same type of influenza in the USA. They are in Texas and California. None are fatal. American officials are now concentrating on what's happening in Mexico to determine if there's a connection and just what other bugs are out there.
We do know or have heard from the health officials in Mexico that there are other influenza viruses that are circulating there.
In Ontario, the medical officer of health held a telephone news conference saying there are no confirmed cases here. Physicians are, however, calling from all over the province to report patients with mild flu-like symptoms.
Severe ones that we would classify, because again, we do not have a strict case definition. We don't really have that many that meet that kind of category, and some that even got closer, we sent them off for tested.
Most of the flu cases in Mexico have been reported around Mexico City and away from coastal areas where Canadians usually visit. Still, the Canadian government is advising travelers to be vigilant. In the meantime, anyone who's either been in Mexico within the last 10 days and is experiencing flu-like symptoms or has been with someone who has is being urged to get checked out. In Toronto, Julia Burke, A News.
And with more, Dr. Bryna Warshawski is the Associate Medical Officer of Health for the Middlesex London Health Unit. And thank you for coming on the program tonight.
You're welcome.
Doctor, do you have any reports of anyone from this area being affected by this?
We have had a few people present to hospital who have been to Mexico who have some respiratory symptoms, but on investigation we don't have anybody who meets the definition of a severe respiratory illness. So at the moment there is no one that we are concerned about in our community.
All right. Now, in terms of anyone planning a trip to Mexico, should they be doing that first of all? And if so, how do they avoid this?
Well, right now the situation is changing on an ongoing basis, so if people are planning a trip, we advise them to check the Public Health Agency of Canada's website, which will be issuing travel advisories if things change. So anyone who does travel should be really up to date, should consult a travel medicine physician before traveling, and should check out the latest travel advisories before they go.
All right, there's some great advice there. What do we know about this strain, and do we know why young people seem to be making up the bulk of those infected so far?
We do know that there has been some laboratory confirmation of what they're calling a new strain that appears to have some connection with pigs. It is a new strain and it appears to be causing a spectrum of illness, meaning some people have mild illness and some people have more severe illness. We don't yet know why it's affecting some age groups in different ways. We don't have enough information at this point.
All right, well, I do appreciate your answers on this. Thanks very much, Dr. Bryna Warshawski, joining us this evening.
Thank you.
Well, the cleanup has resumed.